For coming today. I just guess I'd like to, on the back of the 4 cases that we had in Wagga over the weekend, I'd just like to reiterate that it's obviously a real concern that COVID is around, and it is possible that we will get cases in our area continuing on from now. And the message is to continue on with your hand hygiene, your social distancing, and to wear a mask if you're in an area where you can't social distance, where there's a large crowd. And the recommendation, of course, for employers of businesses where there's lots of face-to-face interaction with clients, that you wear a mask at those times as well. The wearing of mask is just part of the message, of course. As I said, hand hygiene and social distancing is really important as well. If you adhere to that, if you're unwell, don't go and visit people. We don't want to risk spreading any illness, so particularly vulnerable people. And again, reiterate, if anyone has any symptoms, please get tested early and isolate while you're waiting for those test results. The test result timeframes are coming back faster now, within 30 hours, around about on average. So you can get your test result pretty quick. So please isolate for that period of time, just so that if you are unlucky and have COVID, that you're not spreading it in the community.
We've heard a lot from the New South Wales government in recent weeks since this border closure, and them I guess saying that we are the front line here, and the last thing they want is outbreaks or anything like that across New South Wales. It must be pleasing though to realise that we've had only really a handful of cases here, and all of those have been managed quite well.
Look, I think it's comforting to know that, and a relief to know that so far that is exactly the case. The family who were isolating, or who are isolating in Wagga, actually adhered to their permit conditions and isolated when they arrived. So that meant there was no additional contacts, and that is fantastic and a credit to that family. So I think that when people do the right thing, it enables us to keep that the hope of elimination of COVID alive.
And in terms of an update on that family, we understand that I think it was a woman in her 50s. Understand that this weekend might be that critical stage on finding out sort of which way her symptoms might go.
Look, obviously when people have COVID, it is a disease that runs its course over about 10 days, and we do know that people can deteriorate at about day 5 or 6. But other people, are very mildly affected by COVID, and some don't even realise that they've got the illness. So I think that we're monitoring her symptoms. She's the family's been engaged with our hospital in the home system at Murrumbidgee, so we're checking on her every day to make sure she's fine, and the family is fine, and so she's in very good hands.
And the child as well, all fine?
Yes, so the family is fine at the moment, and as I said, they're engaged in our hospital in the home system and being checked up on daily to make sure that they have everything they need to stay well.
Just wanted to confirm, there's no chance that when they did travel back from Melbourne that they stopped off anywhere? That's all been confirmed with them?
The contact tracing has indicated that there were no other at-risk exposures from that family.
Okay.
Thank you.
In terms of the pop-up clinic in Wagga at the showgrounds today, how's that tracking? How's that gone?
Look, that's been set up now, and it will opening hours is between 9 a.m. and 4:30 p.m. Monday to Friday, and they're also going to be open on the weekend from 9 to 2:30 p.m. So encourage anyone in Wagga who wants to get tested to go to that clinic. There's plenty of room there, and there's plenty of nurses ready to swab.
Is that as a consequence to these 4 cases in Wagga?
Yes, so it has been set up acknowledging that more people may wish to be tested after knowing that there has been COVID in the region, and so the Murrumbidgee Local Health District does set up pop-up clinics wherever there may be an increase in demand, and we've done that across the district over the last number of months.
Sorry to jump back and forth here, but the Lavington cases, have we got an update on them at the moment? Are they still recovering? Are they still active?
Look, those Lavington cases are out of isolation. They are free to, they're not considered infectious anymore, and they can go about their daily activities, yes.
Are they still recovering though? Or?
They still are indicated in our data that they haven't 100% recovered, but they're well enough in the community, yes.
We've got stage 3 restrictions coming into place in Victoria tomorrow, and obviously everyone there has to wear a mask. I know we don't have any cases here, but are you sort of putting out a message for people to still be a little bit careful about what they do in their day-to-day?
Look, it's really important that people do social distance, and you know, as I said earlier, the recommendation to wear a mask when you can't socially isolate or can't isolate from people is a good idea, and of course those workers who are face to face with the public every day, it's recommended that they wear masks as well. Mask is just part of the picture, as I said. It is part of the picture to protect yourself. The other things is good hand washing as well, staying home if people are unwell as well.
What is the catalyst for, I guess, compulsory wearing of masks? We saw it happen in Victoria. They were encouraged, then urged, and now it's compulsory to wear masks there, but here in New South Wales they're not at that stage yet. Does it need to be a tipping point or a catalyst for that in terms of maybe community transmission?
Yeah, look, it's a decision made by the Chief Health Officer around the actual risk in the community, and some of that is, there's a lot of factors weighed into that, but obviously the number of cases, but also the number of cases that are, the source is unknown. So when you know the source, you're able to identify the COVID is more contained. You'll be able to know what the risks are. When you have unidentified sources, we just don't know who's walking around with COVID potentially, and that can increase the considerations for wearing a mask. And when there's lots of people around, that obviously that consideration is factored in. So it is a decision of Chief Health Officer, but that's largely how it's sort of determined.
I guess a bit more broader, Victoria looks like it's recorded more than 700 cases again today. I know there's like a bit of pressure, I guess, on the Premier or New South Wales authorities to close the border or have more restrictions to make sure there's none of those cases leaking out. Is that something that you think needs to happen, or because these restrictions are coming in Victoria, there's not that as much concern that they'll come into New South Wales now that less people will be travelling?
Yeah, it's always a really difficult balance for the governments to determine how much they will restrict human movement. I think that the tighter restrictions in Victoria do take a couple of weeks to see the results of, and certainly the New South Wales Chief Health Officer is monitoring those very closely, and at the moment I think potentially those restrictions are tight enough, but remembering they are tightening up some of the permit abilities to get permits and exemptions.
Apologies if it's been covered, but is there a testing availability at checkpoints? Are you linking those things at all?
At the moment, I understand that's not occurring. I think that they can be referred into testing clinics from the checkpoints. I think it's a matter of traffic management, and it's quite difficult if you've got people lined up to get through a border to then have them delayed in getting across because there's testing occurring as well. So anyone who is symptomatic, there's plenty of testing points around most areas, so that if you're crossing and you're symptomatic and get directed to go to one of those, it's not too difficult to get to one.
Directed, is that can that be enforced?
Look, it's not an enforceable. If someone is symptomatic, we can request that they go to a testing clinic at the moment, and the enforcement can occur. Sorry, let me start again. The enforcement of testing can occur where there's a considered risk for a person being a possible case, but there needs to be some evidence behind that. You in contact with a case previously, just for random people who might be just in the community crossing the border. That evidence would need to be weighed up before you could direct them to do that.
The dog's had enough, so.
Okay, thank you.
Thank you. Thanks,
Thanks,
Tracey.
couple of Cadillacs.
Thank you.